Hi, my name is Mardia, and I am a medical laboratory scientist. And I have been in this field since I was 17, and I am now 28, so quite a bit of experience here. I came across this case from Instagram, or this person from Instagram who shared their melanoma story, and I was just curious, and I thought it was very fascinating. Posted it on my channel, and it kind of blew up. So I just wanted to touch base and let you all know. Hopefully, I created this slide right here or this presentation in hope to answer some question as well as to educate on what melanoma is and how to look out for them. So, in this presentation, I will try to answer these five bullets. What is melanoma? Symptoms of melanoma, effects of melanoma, melanoma cues, ways to combat your chances of getting melanoma. So, let's start off with what is melanoma. So, melanoma is a skin cancer. It is a very serious and dangerous skin cancer. So, if you are people of color, it's very important to make sure that you are checking yourself consistently, especially if you have molds, anything such like if you have a little mold or so that is growing, developing, you want to make sure you check them out because it is harder to see in um, black people, black and brown people, than it is in other race. So make sure you are checking yourself consistently. Over here, I have posted some slide cells. So this is basically what I looked at. I work mostly in the hematology lab currently, and I mostly just look at blood, like venous blood cells. So over here, these slides are showing cells of the skins, and they're not normal skin cells. I also in the background have the background being posted where you can see a normal skin cell. It's all stacked up accordingly, and as the skin is introduced to more radiation, such as sunlight or other radiation, if you work in a radioactive environment, your skin cells will start to spread a little bit. This is not abnormal yet, but it is something that you need to be careful of. And you, at this point, you should start applying quite a bit of sunscreen. You should always wear sunscreen in general, but once you're seeing your skin cells not in this conform like I would say corn-like shape, in the organized corn-like shape, you should start to be worried a little bit. Over here, you see a mild, abnormal looking skin cell, and as the slide goes on, you develop melanoma, and that's a problem. So this is exactly what happened to um, this person here, and I have attached her name here. This is the individual who went through the procedure, and this was a 2 point procedure, by the way. There was a pathology section of it where they were able to figure out after blood work and after going to lots of clinical diagnosis to figure out that she has melanoma. And then later on, um, another doctor came through, a plastic surgeon, who also her focus is on oncologist patient, were able to use reinforcement to get her head shape back. So over here you can see this girl. She had a hard lump on her on melanoma. Starts with it can start with a little tiny, again like I said, like a little tiny, like you have a little um skin rash or so, and then later on it starts to develop into bigger and bigger, and sometimes even blows up. And in her case, it started very little, and as her skin cells, like as you saw in the previous slide, as the skin cells starts to blow up, then the cells develops and get larger. So this is what happened in her head. So she had melanoma, I would believe, around this area, and then it spread out throughout her scalp and developed in that yellow eyes and skin. So you have jaundice. As you can see here, you can kind of see her eyes are a bit yellow, and obviously she's going through a lot of pain right now, and it could also be, but your eyes turn to be yellowish. You have a buildup fluids in your abdomen and or your tummy area. So you're normally not feeling well in general. You're always going to have tummy pain, hard or swelling lymph nodes. You see that, and even over in your throat area. So when you have any form of skin cancer, you will see those type of stuff. So make sure you are checking everything. So what is the effect of melanoma? Melanoma has physical The effect is physical, sometimes and most time internal. In this instance, this is allotransferred. Al- this individual right here, this is how she looked before her exposure to melanoma, and that's why you see her lumps here. She didn't have that before. As you can see, she had a perfect forehead sculpture, and then after her exposure to and after she have gotten melanoma, and at this point it was serious because you can see that the cells have developed and the cells have spread. So she was under a serious attack at this point. Um, So what happened here? After she was treated fully, at this point here, this patient has been fully treated for melanoma. Her scalp was taken out. That's why you see this big scalp defect right here in the middle center of her head. You can see the scalp defect. She was then seen by a plastic surgeon who is also an oncologist, board certified, and this plastic surgeon, what she did was took a inflatable tissue expander and install it into the gap area of this patient, and it takes weeks, several weeks, because there are a lot of treatment, especially after chemotherapy. If you are doing radioactive or radiation therapy, it's a you have to get cue from your radiation therapy, fully cue, and ring the bell that you're cancer free before going through the second procedure, which she then went through to be able to fill that tissue gap that was missing right in the middle here. So melanoma Q are you can have a surgery. So in her case, her little lump, she had a radioactive. Like the reason why I'm saying is radioactive because you can see it's really dry out here. So they had to go into her scalp and take out the issue her melanoma, or try to kill the cells that are in it. And other ways to cure melanoma is chemotherapy or drugs. So if you are at at the end or stage 3 of melanoma, because there are different stages, if you're at the further end of the melanoma, most time they're using two type of cures. It could be through a radioactive therapy and also a drug. So you will be taking a drug and then going to your therapy, or you will have gone through surgery and also have to take a drug. So depending on the stages of where you're at, your treatment could be worse or better. So, how to prevent skin cancer? So, we know that melanoma is just skin cancer. The medical name for skin cancer is melanoma. It's important to wear your sunscreen daily, consistently. Most it has been recommended to renew your sunscreen every 3 hours. However, if you are using a low If you're using a low SPF sunscreen, it's important to reapply it at least every 2 to 3 hours. Avoid harmful chemicals. Check your skin regularly for moles, growth, and changes. Any form of changes in any mold or any new growth that is growing on your skin, make sure that you are seeing a dermatologist all the on a regular basis. Wear appropriate clothing. So in some part of Africa, people wear long sleeve clothes, like even in Egypt or West Africa where it's hot. People doing when it's really hot outside, you would notice that they wear these full cotton, breathable, long sleeve clothes because it kind of help the sun from penetrate. It acts as a blockage from the sun to penetrate through your skin and then like cause skin cancer or so. So just keeping yourself safe is important. Thank you again for subscribing. And if you have any more questions, leave it down below. And yeah, I will see you in my next talk.